the CEO of the South African Medical Association, I am addressing you today to provide an update on the ongoing efforts of SAMA regarding the concerning issue of commuted overtime. As many of you are aware, recent changes made by the Gauteng Department of Health and those proposed by the Eastern Cape Department of Health regarding commuted overtime have sparked a significant unease among our members and the medical community at large. These changes were made unilaterally without consultation with our members, who are senior clinical leaders in hospitals across these two provinces. Furthermore, these changes have the potential to adversely impact clinical services, academic programs for both under and postgraduate medical training, and will ultimately impact negatively on the livelihood of doctors and their ability to deliver patient care. The details of these changes in the case of Gauteng province remain murky, the only information provided being a circular stating that the approval and the management of commuted overtime will be centralized within the Department of Health. This decision effectively strips CEOs and other senior clinical managers of their authority to manage clinical services in their hospitals. The Eastern Cape Department of Health Circular 34 of 2024 unilaterally directs that, with effect from the 1st of April, doctors will no longer receive their commuted overtime as part of their basic monthly salary. As we all know, colleagues, that many of our doctors rely on the overtime, which constitute at least a third of their basic salary. Removing this income stream puts a financial instability and strain on our members and may further drive the brain drain from the public sector into the private sector, and for them to look for greener pastures in developed countries. The ripple effects of these changes are far-reaching and could have dire consequences for healthcare service delivery in Gauteng and in the province of the Eastern Cape. We cannot afford to jeopardize the well-being of doctors and the quality of the care that they are providing to patients. In response to these changes, SAMA has taken decisive actions. We have sent correspondence through our alternates, informing the two departments of health of our members concerned and highlighting the lack of transparency around this issue. These concerns around overtime, we have made sure that we communicate that the stance of SAMA regarding this concerning issue, we are ready to approach the courts should the rights of our members be infringed. Furthermore, we continue to engage with stakeholders advocating for transparency, accountability, and meaningful dialogue. It is imperative that the needs and the concerns of our members are heard and addressed, and that any decision regarding commuted overtime is taken or is made in consultation with the medical professionals who are directly affected by it. As the voice of the medical community, it is an incumbent among ourselves to advocate for the rights and the interests of our members. The Provincial Department of Health must be transparent and accountable in implementing these changes. We call for meaningful engagement with all stakeholders in managing the difficult fiscal environment which we are all aware of. Our priority remains the protection of the rights of our members, as well as the preservation of the integrity of the healthcare system for the well-being of the nation. We will not waver in our commitment to ensure that our members are treated fairly and that the patient remains at the center or at the core of our profession. Please do not hesitate to contact the South African Medical Association should you be affected by these changes. Click on the link below and we will assist you as we take these cases on a case-by-case basis. Thank you very much.